Welcome to today's mock interview pro session, where we dive into preparing for a chief medical officer interview. If you're aiming for this pivotal role, you've come to the right place. Let's kick things off by exploring how you handle high pressure situations. Here's our first question. Can you share an experience where you had to lead your medical team through a crisis? What happened in the end? This question is designed to understand your leadership skills and how you manage under pressure. Here are some pointers to help you craft your response. Pick a specific crisis that really highlights your leadership abilities. Focus on what you did during this challenging time. Discuss the measurable results or outcomes. Highlight the importance of teamwork and collaboration. Reflect on what you learned and how it shaped your leadership approach. Now, let's consider a couple of example answers.
During a sudden outbreak of a contagious virus at our hospital, I quickly implemented infection control protocols. This led to a 40% reduction in transmission among staff and patients, and thankfully, we managed the outbreak with no fatalities. The experience underscored the importance of swift communication and effective resource mobilization.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Chief Medical Officer. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell us about a time when you collaborated with non-medical staff. How did you ensure the communication was effective? This question assesses your ability to work as a team, especially with those outside the medical field. Let's look at some strategies to effectively answer this question. Think of a specific collaboration with non-medical staff. Emphasize the need for clear communication. Mention the communication tools or methods you used. Discuss how teamwork improved patient outcomes. Wrap up with what you learned from the experience. Here's an example answer to guide you.
In a previous role, I worked with the IT department to roll out an electronic health record system. We held regular meetings to align our goals and used project management tools to track our progress. This collaboration not only eased the rollout process but also enhanced data accuracy, benefiting patient care greatly.
Describe a tough decision you made regarding patient care. What factors did you take into account? This question explores your decision-making skills, particularly in complex situations. Here are some helpful tips to tackle this question. Select a patient case that presents clear challenges. Outline the medical, ethical, and emotional considerations. Explain your decision-making process step by step. Describe the outcomes and what you learned. Show how your decision reflects your leadership values. Consider this example as a potential answer.
I once had to decide whether to continue aggressive treatment for a terminally ill patient. I weighed their quality of life, the care team's opinions, and the patient's wishes. I chose to shift our focus to palliative care, ensuring comfort in their final days. This reinforced the importance of compassionate, patient-centered care.
If you were to face budget cuts, how would you decide which departments and services to prioritize? This question examines your ability to allocate resources effectively and make tough prioritization decisions. Here's how you can approach this question. Assess the impact on patient care and outcomes. Engage department leaders for their insights. Identify essential services that must be maintained. Look for areas where inefficiencies or savings can be achieved. Communicate transparently with all stakeholders. Let's look at an example response.
In the face of budget cuts, I would first evaluate each department's contribution to patient care and safety. Services directly affecting patient outcomes would take priority, while I would collaborate with department heads to identify areas for potential savings without compromising care.
How would you handle an outbreak of a contagious disease within your facility? This question assesses your preparedness and response strategy for public health crises. Here are some key points to consider in your response. Immediately activate the facility's outbreak response plan. Communicate swiftly with staff and stakeholders about the situation. implement strict infection control measures to prevent the spread, coordinate with public health authorities for guidance and support, continuously review and analyze data to adapt the response as needed. Here's an example to illustrate a strong response.
Upon confirming an outbreak, my first step would be to activate our outbreak response plan and notify all staff. I'd enforce infection control procedures such as isolation and enhanced sanitation, while maintaining open communication lines with local health departments for guidance as the situation evolves.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.